Hey guys, this is Tyler with Southern California EMS Training Institute. Today in this video we're going to be talking about blood pressure and how to auscultate a patient's blood pressure. First thing we want to do is when we're auscultating a blood pressure, number one is we're going to need our stethoscope because in the medical field, auscultate means to listen. So we're going to need our stethoscope, and again, to auscultate a blood pressure is the best way to get a blood pressure, is the most accurate thing that we can do to get a blood pressure. We're also going to need our blood pressure cuff. Our blood pressure cuff is going to need to go on your patient's upper right arm, or upper arm really. It doesn't need to be the right arm, but we're going to go ahead and put it on and just wrap it all the way around the patient's arm, making sure it fits nice and snug. You should have a little arrow right here that's pointed onto the right arm. We want it just on the inside of the patient's arm to get the most accurate reading. Next thing we want to do is once our blood pressure cuff is on, is we also want to feel or palpate the patient's brachial pulse. So we're going to feel where the brachial pulse is. Once I feel a nice strong brachial pulse, I'm going to go ahead and put my stethoscope on. And I'm going to go ahead and pump it up, and I'm going to get a good accurate reading. When we're pumping the blood pressure cuff up, we want to pump it up nice and slow, and we should pump it up past about 20 or 30 millimeters of mercury of pressure past a normal systolic reading, typically around 160 millimeters of mercury. So I'm going to go ahead and pump it up. I'm going to let it out nice and slow. And I'm going to be listening for a thump or the patient's pulse. Once I hear a thump, I'm going to record that thump as the patient's systolic number. Now I should be hearing thumps after my first initial thump, and again that is my patient's blood pressure. And once I hear the very last thump, that is known as the diastolic number, and I record that as the diastolic number or the diastolic reading. That's how to auscultate a blood pressure. Again, we're going to talk about how to palpate a blood pressure as well, but we'll do that in another video. This is Tyler from Southern California EMS Training Institute. Thank you guys very much. Hey guys, this is Tyler with Southern California EMS Training Institute. Today we're going to talk about how to palpate a patient's blood pressure. First off, to palpate means to feel in the medical field, so we're going to be actually palpating the patient's blood pressure instead of auscultating it with our stethoscopes. One thing we want to know about this is really good for any time we're in maybe a loud environment where it's difficult to use our stethoscope, or maybe we're just having a hard time hearing it. We can move into palpating a blood pressure. Be aware that palpating a blood pressure only gives us the systolic number, and it's not as accurate as if we were to auscultate a patient's blood pressure. So first thing we want to do is we want to start off by putting the blood pressure on the patient's upper arm, wrapping it around nice and snug. Again, making sure that arrow is right on the inside of my patient's arm, and then I can see my gauge nice and well from where I'm ever sitting. Make sure the patient relaxes his arm and has both feet flat on the ground. Next thing we're going to do is we're going to palpate the patient's radial pulse. We should be able to feel a nice strong radial pulse. Once we have the patient's pulse, we're going to pump it up. All right, about 20 to 30 millimeters of mercury pressure past a normal systolic number, about to 160. At this point, we shouldn't be feeling the patient's radial pulse anymore. The blood pressure cuff should be constricting around and cutting off circulation, so we shouldn't be feeling this patient's radial pulse. Now I'm going to let the air out nice and slow. And once I feel that pulse rate come back, that's going to be my patient's systolic number. So once I got my systolic number, I'm going to go ahead and document my patient's blood pressure. His right here was 106, and so I'm going to have a 106 over P, or palpated. So that's how we're going to document our systolic blood pressures. Again, palpated blood pressures are really good for any time we're in a loud, noisy environment, sometimes the back of an ambulance, or sometimes we're just having a difficult time hearing it with our stethoscope. This is Tyler with Southern California EMS Training Institute. Thank you guys very much.